Hey everyone, it's Raj from 3CB. This video is a quick update on Orlando Magic Jonathan Isaac's left knee injury. He suffered a ACL rupture in yesterday's game in the fourth quarter versus the Kings when he drove into the lane, did a jump stop, and you saw his knee buckle inwards, called the valgus movement, on an externally rotated foot. This puts a huge stress on the ACL and is the most common mechanism of injury for non-contact ACL ruptures. The next question becomes, why did this happen? I've had multiple people ask if I believe Isaac was rushed back, and I really don't believe so. The reason for that is because coming off his previous left knee injury in January, a posterior lateral corner injury, or PLC, Orlando was being quite conservative with his rehab. He wasn't expected to come back for the season until the delay happened. And so he was able to meet the required benchmarks and protocols to complete that return to play. However, those benchmarks and metrics are indicators, they're not certainties, and they come with inherent risk, especially as a player is ramping back up. And then additionally, in Isaac's case, with that previous knee injury, there can be some long-standing neuromuscular deficits. The neuromuscular system is a system that unconsciously informs the brain about the body's position in space and helps get it out of dangerous positions. Now, the question becomes after that, how long is Isaac out for? Typically, the average ACL rupture in the NBA is about 9.5 months. That may take longer in Jonathan's case because he is coming off 2 major knee injuries in a short span. Lastly, will this affect his play moving forward? I would love to say no, but considering the sequence of injuries, there's always going to be the risk for long-standing deficits, increased risk for re-injury or compensatory deficits, and also increased knee cartilage wear after this sequence of injuries. The good news here is that he does have access to elite medical care and physio, so that always bodes well. One of the hardest things for him may be the mental component. He just got out of an extended rehab and now he's going back into a long physio rehab. That's not easy mentally, and he needs to take this as yet another challenge for him. We also know the research shows that one of the last things to come back after an ACL rupture is confidence in movement. The term is called kinesiophobia, fear of injury or movement. And so that may be one of the things that he's dealing with, especially after 2 knee injuries back to back.